So the future of AI oncology is increasingly promising, not just in pushing the boundaries of what's possible in cancer care, but also in making sure that more personalized, more precise, and more accessible worldwide therapies are available.
In this special edition episode, Cancer Network spoke with Viviana Cortiana from the University of Bologna and Yan Leyfman from Mount Sinai regarding their most recent manuscript published in the journal Oncology titled Artificial Intelligence in Cancer Care, Addressing Challenges and Health Equity. Watch as they discuss the impact AI has on cancer care and how they expect to see it evolve in the future.
So first of all, overdiagnosis is defined as the detection of cancers that would never cause symptoms or harm during a patient's lifetime. And this is a major concern and problem in oncology, actually. For example, as we report also in our research in breast cancers, the study report that up to 55% of cancers are actually overdiagnosis. And randomized trials suggest that on average, we have between 11% to 22%. This leads to unnecessary treatments, first of all, that can cause also serious physical and emotional burden and side effect. For example, dysfunctions from radiotherapy, for example, in prostate cancer patients, together with also significant financial hardship. Indeed, financial problems are substantial when we see cancer care, and has been estimated that around 42% of Americans with cancer lose their savings during treatment because of treatment. Therefore, when we integrate AI with precision medicine, we could have a potential and powerful solution to this issue. Indeed, if we analyze, for example, comprehensive data sets like imaging pathology as well as genetic profiles, we can have an help for clinicians to determine whether a specific treatment is really necessary and needed. For example, in prostate cancer, AI can assist in identify which patients may require more aggressive interventions and avoiding overtreatment in those that are indeed not associated instead with a poor prognosis. However, to fully realize this potential benefit that we have, AI also must be validated and trained with diverse and also high-quality data sets. Without this, indeed, there is the risk for overfitting, misdiagnosis, and also bias. Therefore, we have some challenges that could compromise accuracy and equity in care delivery. But still, within these adjustments, the field is very promising and could indeed offer potential important solutions. Yeah, so population-specific AI models are critical for being able to deliver accurate as well as equitable cancer care. Indeed, the effectiveness of AI systems depends heavily on the quality as well as the diversity of the data on which they are trained on. Therefore, certain populations actually are underrepresented, and this results in models that are biased or also inaccurate and potentially leading to suboptimal or even harmful events and outcomes. In our paper, indeed, we highlight that several examples are present in which population-tailored models have advanced oncology. For example, we mentioned how in oropharyngeal cancer, AI can analyze pathology images to assess the multinucleation index, which is an important marker which is linked to prognosis. When indeed these models are validated across diverse groups, can improve predictive accuracy as well as treatment planning. We also report how this is happening in lung cancer, where understanding the spatial arrangements of tumor-infiltrating lymphocytes can help in personalizing immunotherapy decisions and also avoiding unnecessary chemotherapy. These applications are especially impactful in low and middle-income countries, where cost-effective and AI-powered diagnosis can democratize access to care. But again, achieving this requires not only technical development, but also an ethical oversight and transparent model design to be able to ensure that AI supports, first of all patients and not just those reflected in dominant data sets or privileged geographical areas. Yeah, this is a great point indeed. And AI is indeed helping to also close the gap that we currently have in cancer care, especially in low and middle income countries, by providing a scalable and also cost-effective solution. Indeed, with limited access to specialist or diagnostic infrastructure, many regions can benefit from AI-enabled tools. For example, we have mobile diagnostic, remote pathology analysis, but also clinical decision support system. For example, we have a great example of Massive Bio, which is co-founded by Dr. Arturo Loaiza Bonilla, who we also recently hosted at MedNews Week. He founded this platform, which is great and uses AI to match cancer patients with clinical trials, including those in underserved regions. And by simplifying, therefore, eligibility screening as well as expanding clinical trial accessibility globally, Massive Bio is significantly improving outcomes as well as offering hope to patients who previously had limited treatment options. And this innovation shows, therefore, how we can utilize AI to help optimize also resource allocations, as well as improve equity in cancer care delivery. But still, to scale these effectively as well as ethically, these tools must be developed with transparency, guided by local needs, and also integrated into existing health system thoughtfully, which requires collaborations between public health, between clinicians and researchers, as well as, of course, patients.
So the ethical adoption of AI in oncology rests on a few core pillars: data security, transparency, clinical validation, and addressing algorithmic bias to ensure equitable care. Each one plays a critical role in its own way to make sure that AI isn't just innovative, but also trustworthy and fair. So starting first with data security, now we're dealing with an incredibly sensitive amount of information: medical history, genomic data, imaging, and so on. And so protecting patient privacy is paramount. Now that means encryption, securing storage, and strict access controls, but also more forward-thinking approaches like federated learning, which will then allow for collaboration models without sharing raw patient data. Transparency is the next pillar. One of the major hurdles right now is the so-called black box problem, where AI makes recommendations, but the rationale isn't always clear. And that can really erode trust from both clinicians and patients as a whole. So we need to make explainable AI, so to speak, tools that can clearly show why a recommendation was made, highlight the most influential variables used, and communicate limitations up front. That's essentially important in oncology, where treatment decisions are so high stakes. Then there's also clinical validation. No AI tool should be deployed without rigors of testing in real-world settings. So prospective trials, external validation across diverse patient populations, and also benchmarking against standard of care practices are all crucial. The goal is really to ensure that these tools don't just work in a lab, but they need to deliver real world, real impact in real practice in real time for all kinds of patients. That brings us to algorithmic bias, which is a major concern. If AI is trained on data sets that are underrepresented in certain populations, it can lead to disparities in diagnosis or treatment recommendations. And that's particularly troubling in oncology, where outcomes can already vary based on race, gender, or socioeconomic status. So to address this, we need diverse, representative data sets with regular audits of model performance across subtypes and subgroups, and fairness awareness algorithm design. So it's also vital to involve diverse stakeholders, including community health advocates, early in this developmental process so that they can catch blind spots before these blind spots are able to impact care. And finally, patient autonomy cannot be overlooked. Patients need to know how their data is being used and what role AI is playing in their care. That means clear, accessible communication, robust consent processing, and this is all backed by overall ethical oversight. So in short, responsible AI in oncology isn't just about a technological sophistication. It's also about embedding ethics, inclusivity, and patient-centeredness at each and every step. When we do this, we not only improve outcomes, we're helping to build a system that patients and clinicians can truly trust. So the future of AI oncology is increasingly promising, not just in pushing the boundaries of what's possible in cancer care, but also in making sure that more personalized, more precise, and more accessible worldwide therapies are available. Now, we're already seeing AI play a big role in early cancer detection. Algorithms are able to pick up subtle patterns in imaging and genomic data that may be missed by the human eye. For example, deep learning models may outperform radiologists in detecting early lung cancer on low-dose CT scans. Now, if we can scale these tools, they have the potential to dramatically shift diagnosis to earlier stages, whereby survival rates are significantly higher as a whole. In another exciting area is precision oncology. AI can help tailor treatments to that particular individual based on analyzing massive data sets, everything from tumor genomics to prior treatment responses. So instead of a one-size-fits-all approach, we're moving toward predictive models that can guide therapeutic choices, especially for complex treatments like immunotherapy. This can improve response rates and reduce unnecessary side effects. Now, we're also seeing AI streamline clinical workflows, automated documentation, prioritizing urgent cases, supporting real-time decision-making, and that's especially valuable in resource-constrained environments where clinicians are stretched very, very, very thin. But perhaps one of the most impactful areas of AI could be in addressing disparities in cancer care. In low and middle income countries where specialists and resources are limited, AI tools can help to be a bridge. Mobile diagnostics, cloud-based platforms, and remote consultation capabilities can help to expand access to care where it's needed the most. Now, at the same time, we can't just build powerful tools and hope that they're able to work everywhere. To translate AI interventions into meaningful outcomes, we need to be deliberate. First, we need rigorous clinical validation. These tools must be tested across diverse populations to ensure that they're safe, effective, and equitable. They also need to tackle algorithmic bias head on. AI is only as good as the dataset that it's trained on. If the dataset isn't representative, we risk reinforcing disparities instead of reducing them. So regular audits and fairness awareness models are needed and should be standard practice. Integration is another key. These tools need to fit seamlessly into existing clinical workflows. That means user-friendly interfaces, interoperability, and electronic health records, and most importantly, clinician training. We have to ensure that people who are using the AI understand how to interpret and question its outputs. AI should enhance, but not replace human judgment. And finally, um, global partnerships will be vital. Tech companies, governments, NGOs, and healthcare systems need to work together to fund, deploy, and adopt AI solutions for local contexts, especially in regions that are known to be underserved. Public trust and transparency will be critical in this regard, and will post deployment monitoring to continuously improve these tools based on real world use. So, in short, AI has the potential to fundamentally change how we detect, treat, and monitor care. But realizing that promise, especially in a way that's equitable, will require collaboration, validation, and thoughtful implementation, and a commitment to leaving no patient behind.